Did you know that breast cancer affects millions of women around the world? It's one of the most common types of cancer, impacting approximately 15% of women. Finding it early is really important for better treatment and survival rates. Unfortunately, lots of women don't know enough about finding it early and end up losing their battle. Sadly, some women only go to the doctor when the cancer is already really bad. This makes treatment even harder and lowers the chances of surviving. The good news is that if caught early, breast cancer can be treated. That's why we've made this video to tell you about the signs of breast cancer. We'll also give you tips on what you can do. Just remember, we aren't doctors, and this video is for informational purposes only. Sign number 1. Breast lumps. The presence of a breast lump can evoke fear and anxiety. Yet it's essential to approach it with clarity and understanding. Breast lumps may vary in size, texture, and sensation, but not all are indicative of cancer. Understanding the characteristics of a concerning lump is crucial. Cancerous lumps often feel firm, irregularly shaped, and may be painless. Diagnostic tests such as mammograms, ultrasounds, and biopsies can provide valuable insight into the nature of the lump and guide treatment decisions. Sign number 2. Changes in breast size or shape. A sudden and persistent change in breast size or shape should not be overlooked, as it could signal an underlying issue such as breast cancer. While minor fluctuations in breast size are normal due to hormonal changes or weight fluctuations, significant and unexplained alterations warrant attention. This may include one breast appearing noticeably larger or smaller than the other, or a change in breast contour or symmetry. These changes may occur gradually or suddenly, without an apparent cause. Sign number 3. Skin irritation. Persistent itching or irritation on the skin of the breast, especially if it does not improve with topical treatments, should be taken seriously. While occasional skin dryness or itching is common and may not indicate a serious problem, persistent irritation localized to a specific area of the breast could be a sign of underlying breast issues, including cancer. In some cases, the affected skin may appear red, scaly, or a pitted texture resembling an orange peel. These changes in skin texture and appearance should prompt further evaluation to rule out serious conditions or ensure appropriate management. Sign number 4. Lump near collarbone. Discovering a lump near the collarbone or underarm area can be concerning, as it may indicate the spread of breast cancer to nearby lymph nodes. Lymph nodes play a crucial role in the body's immune system, and their involvement in cancer can signify disease progression. These lumps may feel firm, immovable, and tender to the touch, signaling potential metastasis. While not all lumps in these areas are cancerous, prompt evaluation is necessary to determine the cause and appropriate course of action. Diagnostic tests such as imaging scans and biopsies may be recommended to assess the extent of lymph node involvement and guide treatment planning. Now, before we proceed to the next surprising warning sign of breast cancer, like and subscribe to NATURALdocTV to stay updated. Sign number 5. Breast or nipple pain. While many breast cancers are painless, persistent and unexplained pain in the breast or nipple should be investigated further. This pain may manifest as a dull ache, sharp stabbing sensation, or burning discomfort, and may be localized to one area or more widespread. While breast pain can result from benign conditions like hormonal changes or fibrocystic changes, it can be a symptom of breast cancer. Diagnostic tests such as mammograms, ultrasounds, or biopsies may be recommended to determine the underlying cause of the pain and appropriate next steps. Sign number 6. Visible veins on the breast. An increase in the visibility of veins on the breast, particularly if they appear suddenly or without an obvious cause, could indicate an underlying issue, such as breast cancer. While it is normal for veins to become more prominent with age, exercise, or changes in hormonal levels, new and persistent vein enlargement should be evaluated. Cancerous tumors can disrupt the normal blood flow in the breast, leading to swelling and increased visibility of veins. Therefore, any new changes in breast vein appearance should prompt further investigation to rule out serious conditions and ensure appropriate care. Sign number 7. Inflammatory breast changes. Inflammatory breast cancer, or IBC, presents a unique set of symptoms characterized by the rapid onset of swelling, redness, warmth, and sometimes itching in the breast. Unlike other forms of breast cancer, IBC may not manifest as a distinct lump, but rather as diffuse thickening of the breast tissue. This aggressive form of cancer can cause the entire breast to appear swollen, often making it larger than the unaffected breast. The skin may take on a reddish or purple hue, resembling an inflammation or infection. Sign number 8. Dimpling or puckering of the skin. Dimpling or puckering of the skin overlying the breast can be an alarming sign that should not be ignored. This condition, known as peau d'orange, may occur when the breast tissue thickens due to the presence of a cancerous tumor pulling on the skin from below. The dimples may be more subtle or more pronounced, resembling the texture of an orange peel. Additionally, flaky or scaly skin around the nipple and breast may accompany this symptom. While peau d'orange can also result from benign conditions such as infections or inflammation, it is essential to have any changes in breast skin texture evaluated. Sign number 9. Unusual nipple discharge, including hormonal changes, medication side effects, or benign breast conditions like ductectasia. However, certain types of breast cancer such as ductal carcinoma in situ, or DCIS, or invasive ductal carcinoma, or IDC, can also present with nipple discharge. Therefore, any new or concerning changes in nipple discharge should be promptly assessed to determine the underlying cause and appropriate management. Diagnostic tests such as mammograms, ultrasounds, or biopsies may be recommended to evaluate the extent of nipple discharge and identify any underlying breast abnormalities. Taking action. 5 crucial steps to follow. When it comes to breast cancer, taking action is crucial. By being proactive and aware, you can increase your chances of early detection and successful treatment. Here are 5 steps that every woman should follow. Step number 1. Know your risk factors. Underlying your personal risk factors for breast cancer is the first step. Factors such as age, family history, genetic mutations, and lifestyle choices can contribute to your risk. Step number 2. Perform regular breast self-exams. Become familiar with the texture, shape, and size of your breasts through regular self-exams. Look for any changes such as lumps, thickening, dimpling, or nipple discharge. If you notice anything unusual, consult your doctor. Step number 3. Get screened with mammograms. Mammograms are an effective tool for detecting breast cancer at an early stage. For women aged 40 and above, regular mammograms are recommended. Discuss with your doctor to determine the frequency that suits your individual circumstances. Step number 4. Be mindful of lifestyle choices. Maintaining a healthy lifestyle can lower your risk of developing breast cancer. Engage in regular physical activity. Maintain a balanced diet. Limit alcohol consumption and avoid smoking. These positive lifestyle choices contribute to overall well-being. Number 5. Understand your family history. Know your family's medical history, especially related to breast cancer. In some cases, genetic mutations such as BRCA1 and BRCA2 can significantly increase the risk. Remember, early detection is key to successful treatment and improved outcomes.